And I have with us right here the Business Development Lead India, Zipline International, Mr. Assad Joubran. I'm going to request him to please say a few words, present the idea, and of course we're going to look forward to a launch right here in India because it's never really happened before and we'd like you to take the lead on that. Ladies and gentlemen, let's hear it for Zipline. Let's hear it for Mr. Assad Joubran.
Hi, everybody. I understand I'm the last speaker before lunch, so I assume you're hungry. I'll do it very quick. Thank you very much, first of all, for Apollo for hosting us here. It's an exciting and inspiring event. And thank you very much for the warm introduction for Mr. Rajesh Ranjan. Okay. So the leading cause of maternal deaths globally is postpartum hemorrhage, which is basically an excessive bleeding of a patient following a childbirth. It accounts for 25% of all cases, maternal mortality cases. In such a situation, the patient will immediately need a transfusion of large amounts of blood to stabilize her condition. And sometimes blood banks in hospitals don't have the sufficient blood units to do that. And some places they don't even have it at all at the blood bank. And in this case, the patient's life is in danger. Our mission in Zipline is to provide every human on Earth with instant access to vital medicines across the globe. We are a California-based company. We're an automated logistics company with more than 200 employees today, backed by the largest leading investors in the Silicon Valley. What we're solving is basically a dilemma. So healthcare, access to healthcare relies a lot on the reliability of the supply chain to maintain availability of all medicines and all essential medicines at each facility. In some parts of the world, in remote areas, these hospitals don't have the access for these medicines, mainly due to lack of infrastructure or difficult terrain conditions. In some other parts, when health systems wants to ensure 100% of availability of these products at each facility, that means that they have to manage a decentralized high inventories of products at each facility. And that eventually causes to a lot of waste. So basically, with just-in-time delivery of products using drone, we solve this problem. We eliminate the waste and we eliminate stockouts because in a few minutes from your order at the hospital, we can deliver the product you want in a very accurate and reliable way. You can see here how we operate. We basically get to our distribution center the products from the customer and we deliver them to their hospitals using our drones. Let me show you a video of how we operate. So you can see here, this is a video that shows how we operate. We operate from distribution centers. We'll show you now how distribution centers look like. It's basically a warehouse that we build, we operate ourselves. We manufacture the drones, we design it, we do all of this work. And in the warehouse, we basically have a pharmacy that stores all the blood, vaccines, and medicines inside, and it's operated by our own pharmacists. And they're all local. Our policy is to hire local employees and they run the whole operations. In addition to pharmacists, we have also flight operators that they do all the flight operations. So how do we make the order? We receive an order from a hospital. It could be either on the phone or a WhatsApp message or an email. Our staff picks it up from the refrigerator, put it in the package. You can see there's special packaging for it. Puts it in this box. You can see this red box. that have a paper parachute on it. We don't land at the destination. We drop it with this package with a parachute. Once the package is put in the drone, we put it on a launcher system. We don't have a runway. We basically put it on this launcher. Within less than half a second, we reach from 0 to 100 kilometers per hour. When the drone leaves the launcher, it's autonomous. We don't have any pilot, any joystick. It flies directly to the hospital. Before it arrives to the hospital, it will give the hospital a message to the person who made this order. Please come outside, pick up your packages here. And the drop, when the drone arrives to the hospital, it descends to around 30 feet and drop the package in a very accurate way. It's like an area size of 2 parking lots. That's what we usually do. Then the healthcare staff take it back. And this is how we recover our system. We don't have a landing gear. We basically have a recovery system that catches the drone in the skies with a 1 centimeter tail hook on the drone, which is a very accurate way. And we do that 150 times a day. Yeah, this is our drone. It can fly to 160 kilometers range, which means 80 kilometers for the destination that we're going to deliver and 80 kilometers back. We can fly at 110 kilometers per hour. We can carry a payload of around 1.8 kilograms. And we can do around 500 deliveries a day from a distribution center. And we can fly between distribution centers, so we can fly even a longer range. The good thing as well with the drone is that it can fly with almost any weather condition, which is also very important for our operations in many countries that we operate today and in India soon, I hope. We have our own traffic management system. We call it Birdwatch, where we basically monitor all our drones where they fly. Here you can see a screenshot of it. We have around 9 airplanes in the skies altogether. We know all the flight statistics. We know where they're heading, their speed, all the data when we want, and it's visible to the air traffic control. So we work closely with air traffic control, with the aviation authorities, and we get the permits, and they have full visibility on our drones. Today we operate in Rwanda and in Ghana. In Rwanda, we started 3 years ago. Was the first country to adopt our technology. Today we have 2 distribution centers covering the whole country, a population of more than 10 million people. We're serving more than 500 hospitals. Most of the deliveries of blood and vaccines in Rwanda happens with drones, no cars. We started earlier this year also with Ghana. We have 2 distribution centers now operating in Ghana out of 4, and hopefully we will serve 2,000 facilities, and again, more than 12 million people will be served from these distribution centers. In addition, we just completed the pilot now in Australia for a humanitarian disaster response with our drones in partnership with the Department of Defense of the US. And we're going to soon start operating in North Carolina in the US as part of the IPP project by the FAA. What are our outcomes until today? So we've done now almost 20,000 deliveries, which is quite remarkable in aviation world. And basically, the areas that we serve, they suffer from 0 stockouts, meaning they have full availability of any product they need at the time they need it. And they don't have any expiries. So they're saving money. They're saving cost as well. It's not only just saving lives, it's also cost. And we probably saved more than 5,000 lives during our operations. So, what are our plans in India? So first of all, India has a gap as well between remote areas and cities in health access. And we can see that also in the health indicators that are published every year. And some areas in India suffer from poor access of health. And that results in poor indicators of health at the end and health outcomes. We can help improving that, basically. We're planning to put distribution centers across India and deliver all these medical supplies to all health facilities of government and private sector in India. So we're already have a plan with Apollo hospitals in the government of Telangana to start working in Telangana, and after that, probably in other states in India. We also participating in an expression of interest that was published by the DGCA of India, the Director General of Civil Aviation, together with the Telangana government. This expression of interest will allow us to start experiments of beyond visual and line of sight deliveries in India, which will be probably very unique and a new thing in India. We're also looking to partner with private companies, pharmaceuticals, and distributors. So just to finish my presentation, this is just a newspaper from Rwanda that shows basically how 3 district hospitals have 0 maternal mortalities at a certain period of time. And I hope to see that as well in India, across the country, in remote areas and non-remote areas. So thank you very much. I look forward for our cooperation.